If you think corporations bought free speech before, now that they're human, they'll buy even more. Yeah, their money has free speech.
Welcome to Alliance for Democracy's The Populist Dialogues. This cable access program is part of our effort to create a just society based on an equitable, sustainable economy. I'm your host, David Delk. Our guest today is Dr. Samuel Metz. Dr. Metz has been actively involved with the efforts to create a sometimes called single-payer healthcare system in Oregon. So welcome to the show, Dr. Metz.
Thank you very much, David. It's always great to be here.
Yes, and you were one of our very first guests almost 4 years ago.
I consider that an honor.
Yes.
4 years later, I'm glad to still be here and see you still active as well.
Yes, good. Talk about what has changed or what has not changed in 4 years with regard to single-payer healthcare.
It would be good to talk about what single-payer healthcare means,
okay,
because it means brings up so many different things for different people. Single-payer healthcare is one method of providing universal healthcare in an area in Oregon. Single-payer means that Oregonians take all of the money that they're currently paying in health insurance premiums, that their employers are paying in health insurance premiums, that they're paying in out-of-pocket expenses, co-pays, and deductibles, puts it into a single pot that then pays directly for health care for everyone. There's no intervening health insurance company. There's just one risk pool, everybody. There's just one set of benefits, treatable conditions get treated. There's just one network, every physician and hospital in Oregon, and there's just one set of forms to fill out. That is so efficient from a reduced administrative cost standpoint that it recovers more than enough money to provide comprehensive health care to everyone. And we know that because every single payer system in the United States and around the world provides better care to more people for less money than we do now. Every study that's ever looked at statewide or national single payer in the United States confirms it's the only way to provide comprehensive health care to everyone and save money. There's just no way to do it if we keep doing what we're doing now. What's happened in Oregon? Well, Oregon is a unique state. Unlike most states, Oregon's insurance industry is not dominated by one or two 800-pound gorillas. We've got instead 7 or 8 150-pound gorillas, none of which have more than 15% of the market. Most of our private health insurance companies are not for profit, not a critical issue. But most importantly, 2 of the 3 largest private insurance companies in Oregon, Kaiser and Providence, also deliver health care. Which means if the single-payer ferry comes to Oregon, says, poof, we now have one single not-for-profit agency that's taking care of everyone, and private health insurance is no more, these 2 organizations move all of the people in their insurance wing into their delivery wing because now their delivery population has just tripled. We've had several bits of legislation that have been considered in our legislature. Twice the legislature has considered in committee a single-payer plan for Oregon. But the most important thing that has happened in the last 4 years is the legislature has authorized a study of universal health care in Oregon. It's called the HB 3260 study. The Oregon Health Authority is authorized to look at least 4 different options to provide universal health care. The Affordable Care Act, always a moving target, unfortunately. The Affordable Care Act on steroids, that is with a public option and with a little-known provision called basic health. Single-payer, publicly funded universal care. And another provision in which public funds would be used to buy essential benefits only policies for everyone in Oregon. What's the significance of a study? There have been only 2 state legislatures that have passed universal health care plans that would reduce costs. Vermont's is the most famous. It's going to be implemented in 2017. The California plan was vetoed twice by then Governor Schwarzenegger. In both of these states, a financial study, just like HB 3260 in Oregon, was considered essential to give the legislature the information and the confidence that they need to take action. That's the value of the HB 3260 study. It's a little buzzard in the ointment, however. The legislature did not fund this $200,000 study. So it's us, our public citizens, to provide the funding for this study. And that's what I hope to tell our viewers today about what they can do.
Okay, so obviously one thing would be, without talking about that further, is if people wanted to donate to help fund the study, where would they do? What could they do?
The simplest thing is to go to www.oregonstudy.org.
Okay.
That tells everything that one would want to know about the study. It has the text of the bill, summary, frequently asked questions, discussions, and yes, there's a place to donate. That web page is very graciously hosted by the Healthcare for All Oregon Education Fund, for which we are grateful. The money donated will go toward this study.
Okay, and so in your opening remark there, you said that there are single-payer healthcare systems in the United States now.
Yes.
They're not state-based, I presume.
That's correct.
Talk
We
about that a
have, they're federally based. All of the federal health care programs are single payer. Medicare, Medicaid, VA, Indian Health Service, Public Health Service. All of these apply the principles of single payer, which is the money's all put into a single pool, everyone's treated equally, everyone gets the same benefits, and the agencies that pay for it, in these cases federal, have one responsibility, which is to spend that money as wisely as possible to provide for the best possible health of everyone who participates. What we don't really appreciate much is there are hundreds of private single-payer systems in the United States, and they're run by America's largest businesses. The businesses call them self-funded, but really they're single-payer systems. The employer and the employee contribute to a single fund that provides health care for all employees and their families without discrimination on the basis of health, and without using private health insurance companies as intermediaries. These are some of the most efficient healthcare systems in the United States. They're so efficient that it's the preferred method for every large business in the United States. Over 90% of workers who are employed by large businesses get their health care right now from private single-payer agencies. Why? Because it's simply the most efficient way to pay for health care.
So if the state of Oregon had a single-payer healthcare system for all residents of Oregon, then what would happen to these private systems that already exist with these businesses?
It's an interesting question because Vermont has decided that they'll leave all of the private systems alone. They'll create a single-payer system for everyone who isn't currently in a single-payer system. So Vermont has universal health care, but because of the requirements of federal law, including ERISA, the Affordable Care Act, and Medicare, they've had to bob and weave a bit so that they don't interfere with other programs. Basically, in Vermont, when this is implemented, everybody in Vermont will be getting their health care through a single-payer system, either by their employer, by the federal government, or by the state of Vermont.
Oh, okay. So single payer is actually multiple payers,
Multiple.
except that the thing that they will all have in common is they will not be funneled through insurance companies to make those payments.
That's a very good way to put it.
Right.
It's multiple single-payer systems. It's less than ideal, but considering the challenges in wrestling with the federal government, which in the past decades has made statewide healthcare reform so difficult, it's the best we can do.
Okay. And talk about that system, or talk about what has happened in Canada, because at one time Canada and the United States had almost identical systems. And Canada took, I'm going to say in the early 50s, and you'll correct me on the date, a very different route than what we have done. Talk about that.
That is a very good analogy. Back after World War II, both the United States and Canada had similar employer-based private health insurance systems. In the province of Saskatchewan, their governor, Premier Tommy Douglas, decided that this system was not providing the care to the people in his province, and he was going to institute a single-payer system for his province. That is, no private insurance companies. All the money that was currently being spent on health care would go to the single-payer agency, which would be run by patients and providers. And everyone in the province would have access to every physician in the province, and every treatable condition would get treated. Because it was such a radical concept, there was an extraordinary amount of pushback from the medical establishment. Within a few years, it was working so efficiently, not benefiting just patients, but the physicians, that the bordering provinces began to say, why can't we get better care to more people for less money? We're going to institute our own single-payer system. Province by province by province, all of them adopted this pattern until their federal government said, all right, let's just face the situation. Every province has to establish its own single-payer system, and they all did.
Oh, okay. So there are multiple single-payer systems in Canada as well, based on the province.
Correct. All of their provinces have a different single-payer system, but they mesh seamlessly. Consequently, since this was instituted, Canadians spend about half of what we spend on health care, and their public health is better. Mm-hmm. In just about every measure of public health, they do better than we do. Now, that's not hard. Every developed country in the world spends less money on health care than we do and has better public health. Interesting that a few years ago, there was a poll in Canada. Who is the most respected Canadian of all time? And sure enough, Premier Tommy Douglas was number one. And he beat out Wayne Gretzky and Gordon Lightfoot. You know, you've got competition like that. It says Canadians really value what he did for their healthcare system.
And he was the premier at the time that advocated for and instituted this single-payer healthcare system.
That's right.
Right.
And we could use a few more like him here.
Right. And talk a little bit more about why or how the United States compares to these other the other highly industrialized countries of the world.
That's a very unhappy comparison. When we look at us versus the developed world, we have the lowest tax burden of any developed country. We have the lowest level of social services. We have one of the lowest levels of educational achievement. We have the worst public health record. We have the highest incarceration rate, the highest rate of income inequality, and pay the most for health care of any developed country. There's a critical mass of Americans who have resolved that it's better to fail individually than succeed together. And they're driving our discourse. Every other industrialized country in the world has figured out a way to provide health care to everybody who lives in their country without discrimination and pay substantially less than we do. The secret is not a secret. The United States is the only industrialized country that filters its health care dollars through private insurance companies that can pick and choose who they insure, that can discriminate, and that have tremendous amounts of overhead. Now, other countries, there are some other countries in Europe, for example, that use private health insurance companies. But European private health insurance companies resemble American private health insurance companies the way American football resembles European football. Different rules, different goals, different games. So, for example, in the Netherlands, Switzerland, Germany, France, if I'm running a private health insurance company, I can set whatever price I want. But I have to sell it at the same price to anyone who asks, and anyone can ask me. And I can't discriminate against anyone on their health or their wealth. Second, I can't drop anybody at any time. Not even for failure to pay. The government will do that. Next, I have to pay any licensed provider. There's no in-network or out-of-network. Anyone. And furthermore, I have to pay every bill within 30 days. I can protest it, but only after I pay it. And I have to treat every treatable condition. Under those circumstances, how can I compete? Lower prices, more benefits, better service. American insurance companies don't play by those rules. So how do they compete? You compete by avoiding sick patients. You compete by selling only to people who are wealthy enough to pay high premiums and healthy enough not to need care. You get rid of sick people as soon as you possibly can, which is easy because sick people usually can't work and can't afford to keep up premiums. You restrict your network so that your network doesn't include physicians or hospitals who take care of expensive conditions. And you deny as many claims as you can. The average insurance company denies 30% of all first claims. As a consequence, the United States pays more money and gets less care than any other developed country.
Well, we have this new reform, the Affordable Care Act, Obamacare. Doesn't that address these problems?
The Affordable Care Act has one principal asset. For the first time in American history, the U.S. Congress has said that the health of every American is the legitimate concern of the federal government. Unfortunately, they implemented their concern by doing exactly what we're doing now, more intensely. Remember that the goal of any health care reform is access when we need it, lower costs, and better health. If you don't achieve those, you're not achieving reform. The Affordable Care Act is not universal. It will exclude at least 30 million Americans if it works perfectly. It's not.
Let's just focus on that. Who will be excluded?
The Affordable Care Act compels Americans to buy insurance if they can. So if you're too poor and you can't afford insurance, you don't get any. And if you're too wealthy, as it were, to qualify for Medicaid, or you're in a state that has not accepted the Medicaid expansion, you're left out in the cold. Plus, there's another additional up to 30 million Americans who are underinsured. That is, their policies are so slim that they could go bankrupt if they get the wrong disease at the wrong time. We know that because in Massachusetts, which has its version of the Affordable Care Act, costs have gone up faster than anywhere in the country. Everyone has an insurance policy, but medical bankruptcies have risen 30%. Public health hasn't changed.
In Massachusetts.
Right. There's no reason to think the Affordable Care Act will do any different. So it's not providing access, it's not reducing costs, it is not providing for better health. So if it's not doing all of those, yes, it's a massive piece, 900,000 word piece of legislation. It's not reform, and when the dust settles, even if it works perfectly, nothing will be different. Oregon needs to take the initiative, and this study is the first step toward that initiative.
Okay. And so the study which Oregon legislature passed or authorized, but they
Yes.
didn't fund it.
Yes.
Okay.
It did pass the House Health Care Committee unanimously, which is pretty remarkable considering the variety of people on the House Health Care Committee. And it passed both houses with bipartisan legislation. Interestingly, it was signed by Governor Kitzhaber, and it got an affirmative vote from his competitor, Dennis Richardson. That's about as bipartisan as you can get. In the 2013 legislature, there was a little too much infighting over funding. So we decided, those of us who were supporting this bill said, we're not going to ask the legislature to fund it because you'll vote against it. You just authorize it. We people who want universal health care in Oregon will fund it, we'll get the study done, and then the legislature can act.
Okay. And how much do you anticipate this study will cost?
The estimates based on the other 24 studies in other states and nationally, and from agencies that are interested in doing the study, is about $200,000. And we've already received support from a variety of physician organizations, the Oregon Medical Association, the Oregon Primary Care Association, the Oregon Public Health Association, the Oregon Academy of Family Physicians, National Physicians Alliance. Several unions have contributed, and a couple dozen small business people who see that universal health care is what we need for Oregon.
Okay. All right. And again, I'll do this to be sure that people know.
Yes.
How would somebody actually make a contribution?
The next step for anyone who's interested either in learning or donating, www.oregonstudy.org.
Okay. Okay. Why do you think it is so difficult to pass legislation like this in the United States or in Oregon?
Healthcare terrifies people. Most American families, Oregon families, are one hospitalization away from financial catastrophe. It's a terrifying topic. It's also hideously complex. Who can understand it? So in desperate times, people either cling to what they have or they reach for something that is so simple that they don't have to learn anything about it. Mm-hmm. So why not do vouchers? Why not just exclude other people? Why not just cut back benefits? All of these are simple, one-sentence kinds of solutions that don't work. Getting people to take a deep breath, to sit down and say, if you want better care to more people for less money, let's learn from the systems that already do it, and here's what they have to teach.
Okay.
Universal health care isn't just a goal, it's a tool. The only way to get cost-effective health care, to reduce health care costs, is to cover everyone. And we know that because every system that provides better care to more people for less money takes care of everyone.
Okay. Okay. And one important thing that I learned from listening to you some time ago, which needs to be explicitly stated, I think, is that single-payer health care only talks about how you're going to pay for it. It doesn't talk about where you're going to get the medical care.
That is correct. Single payer replaces the insurance companies. It does not replace physicians and hospitals. It is a financing system. The delivery can be the same. We can still have fee-for-service. We can still have capitated funds. We can still use CCOs. We can still use salaried physicians. We don't have to touch any of that. We just have to have a financing system that includes everyone and provides the same benefits to everyone. You're right. Single payer just handles that one aspect of our healthcare system, but it's the most important and the most powerful aspect.
Right. So in terms of the user, the user is going to still be able to go and see their family physician or choose the hospital they want to. In fact, single payer would actually open those options up.
You'll be able to see any physician or hospital in Oregon. Your network now takes in the entire state.
Great, good. Thank you very much for joining us.
Thank you very much, David.
Okay, good. Our guest today has been Dr. Samuel Metz. Dr. Metz has been a longtime advocate for an alternative to our present American health care payment system, an alternative which would be universal in its coverage, less expensive because it removes the private insurance middleman, and is not dependent on an individual's employment status. Such a system is sometimes called single payer or improved Medicare for all. And Oregon has an opportunity to move beyond the limited reform, which is the Affordable Care Act, also known as Obamacare. Dr. Metz has described how that can happen, including funding a study of 4 possible alternative healthcare financing plans. While the Oregon legislature, with its adoption of HB 3260, approved the study of universal health in Oregon, it did not dedicate funds to conduct the study. That study needs to be funded, and that's up to us. Go to www.oregonstudy.org and donate today. And remember, you don't have to be an Oregonian to contribute. Also plan on attending the Healthcare for All Oregon rally during the opening days of the 2015 Oregon legislative session. Join a hoped-for 25,000-person rally on the steps of the state capitol in Salem to support single-payer universal health care, that is, health care without insurance companies acting as an expensive middleman between you and your health care. The rally is on February 11th, 2015, beginning at 11 o'clock, and at the end, if you can, go inside the Capitol, do a little grassroots lobbying of your legislators. They need to hear our voices for fair and equitable universal health care. Populist Dialogues is a project of the Portland Alliance for Democracy. Learn more about us at afd-pdx.org and about our national organization at thealliancefordemocracy.org. Thank you to Roger Bates, Melissa Hayes, Joan Horton, Brad Leach, Janet Morris, and Tom Thomas for their volunteer time getting us on the air. And I want to thank all of you for watching. Thank you. And I hope that you'll watch again in 2 weeks. Bye.
If you think corporations bought free speech before, now that they're human, they'll buy even more. Yeah, their money has free speech, to me quite a shock, 'cause I never heard my money talk. When a corporation has a colonoscopy, then I'll believe they're human like me.